time and we'll get things going. Hello and welcome all to United Way of Southeast Louisiana's Louisiana Leaders webinar series. I'm Kirby Jane Nagel, your facilitator for today. Behind the scenes, you can't see me. It's a good thing. But we do have some wonderful experts, United Way staff leaders and parish leaders who will join us today. You'll see them all shortly as we begin. Folks, as you're coming online, we'll give everyone just a few more minutes, a few more seconds rather, to join the webinar, get settled in, and tune in with us today. Just a quick housekeeping note, if you are joining us as an attendee online, you have some connectivity problems. We are recording this webinar, so you will be able to access it afterwards on via email. We'll send you a follow-up, and of course on our YouTube channel, United Way SELA, if you search that way. Additionally, if you have any questions, comments as we continue throughout today's webinar, you're welcome to drop them in the chat box so that we can continue and move forward and get to all of the important questions and topics that we're here today to discuss. So we'll be with you to begin the program in just a moment. Thank you again, folks, as we have more and more folks that are joining us. We're waiting just a few more minutes to let folks get online. We all know how we work here on Louisiana time, so we want to make sure that everyone's with us to enjoy the entirety of our program today. We will be respectful of your time and begin shortly. While you're waiting, a wonderful opportunity to learn more about the content, the subject that we'll be discussing today, which is ALICE. ALICE stands for Asset Limited, Income Constrained, Employed. You'll learn more about that topic today. Of course, you can visit our website at unitedwaysela.org/ALICE while you wait to learn a little bit more about the ALICE population in our region. Again, I want to thank all of you for joining us. This is a rescheduled webinar from earlier in the year. And so we're grateful that folks can make the time today to be here with us. We'll begin in just another short few seconds. Thank you. All right, folks, it's 1:05. I want to thank you so much for your time. Thank everyone that's joining us here on today's call. Once again, I'm Kirby J. Nagel with United Way of Southeast Louisiana. It's a pleasure to serve as your facilitator today. For the topic, as I mentioned, we're going to discuss all things ALICE, how local governments in our 7-parish region can help ALICE households thrive. Reminder that we have parish leaders on from a handful of our parishes with us today, and subject matter experts who will pose questions to those leaders so that we can discuss ways in which we can stabilize ALICE households, which will benefit the entirety of our community. We also have some members of our United Way staff joining us today, President and CEO Michael Williamson, and our Chief Executive Officer and Chief Operating Officer and Executive Vice President Charmaine Cassiope will join us today. A housekeeping note as we begin, as I mentioned, this webinar is being recorded and will be shared via email with our attendees as a follow-up. Additionally, you can access this on our YouTube channel by searching for the handle at United Way SELA. So if you are having connectivity issues, we ask that you follow up by watching this through the recorded piece, as of course we know Zoom technical difficulties come and go. And just a reminder that all the participants are also muted, so you can use the chat box to engage during the webinar. Share some of your own ideas or thoughts, strategies, and ways in which you think we can continue to support Alice households or raise additional issues that you would like to be considered for your parish leaders as they take that information with them when they leave. Once again, a reminder, we will not have a live question and answer series, a segment at the end of this webinar, so please use that chat box to your benefit. At this time, I'd like to play a welcome video from Lieutenant Governor Billy Nungesser, who unfortunately was unable to join us today, but we're so grateful he was able to lend some of his time to provide an introduction on Alice households and a little more information on how United Way of Southeast Louisiana is making a difference in the communities in which we live and work right here in Southeast Louisiana. And so with that, I will begin Lieutenant Governor's Billy Nungesser's video. And thank you all again for joining us today.
Good afternoon. I'm Lieutenant Governor Billy Nungesser, and it is a pleasure to be opening up your forum today. I want to thank you, Michael and Charmaine, and the team at Southeastern Louisiana United Way for gathering local leaders to discuss important topics that affect the people of our state. I'd also like to thank the government officials from Jefferson, Orleans, Plaquemine, St. Bernard, St. Tammany, Tangipahoa, and Washington parishes, as well as the attendees for participating in this forum. We're here to talk about Alice, those in our community who are asset limited, income constrained, and employed. According to United Way's latest Alice report, 52% of households in Southeast Louisiana work hard, but they struggle to afford basics like housing, food, transportation, and childcare. United Way of Southeast Louisiana is dedicated to easing the poverty by supporting Alice households to make sure they can afford basic needs. They responded to the recent disaster of COVID-19 with quick relief and long-term recovery plans in 7 parishes with over $10 million impact. The United Way of Southeast Louisiana also helped a lot after Hurricane Laura. They supported 12,000 evacuees in New Orleans. They activated disaster relief fund to collect needed donations. They distributed 25,000 in Uber cards to evacuees. They had over $550,000 in impact through United Way Hands of Entity Volunteer Center. After Hurricane Katrina, I don't know what we would have done without United Way. I'll never forget driving up the highway and seeing a lady walking with a basket of clothes from the Diamond Trailer Park headed to Belle Chase to wash clothes. I gave her a ride, and when I saw the line around the corner, I called the head of United Way and said, I'm on my way to buy washer and dryers, some tin and wood to build sheds to put washer and dryers throughout the trailer parks and the whole community in Plaquemine Parish. United Way quickly matched that with $10,000 of their own, and within days, we were delivering washer and dryers throughout Plaquemine Parish so people had a place to wash their clothes. We also delivered FEMA turkeys. We knew that FEMA trailers would not fit a normal-sized turkey, so we worked with Winn-Dixie to get some small turkeys to provide Thanksgiving dinner. Without United Way, every step of the way, we would have never recovered from Katrina and the many storms that hit Plaquemine Parish. So I know firsthand the impact United Way has after these 2 horrible hurricanes hit Louisiana. Local governments and nonprofits share a common goal. We want to create the best communities possible for our people. That's why I want to encourage each of you to seek out opportunities to partner with United Way and local nonprofits to create communities we can all be proud of. Communities where everyone has a chance at the basics. With your help, we can all make a difference together.
Thank you so much to Lieutenant Governor Nungesser for sharing his thoughts with us today. At this time, I'd like to welcome our President and CEO of United Way of Southeast Louisiana, Michael Williamson, to add some follow-up comments and share a little bit more with you on the work that we're doing to address the instability of Alice households in our region. Michael?
Thank you, Kirby, and let me add my thanks to Lieutenant Nungesser for offering his kind of words, kind of a walk down memory lane for many of us, I'm sure. Also to our parish leaders and expert panelists that are going to join us today to field questions and engage in this important discussion. We appreciate your attendance and participation as well. We don't do this alone, and certainly I don't do this alone. So Pam, Allison, and Mary Johnson, our team, have been the keys behind this, along with Kirby and other members of our team. thanks to my staff team for all the work they're doing, and to our attendees, both that are here today and those that will watch later. Thanks for tuning in, and we hope that this is information you find useful. So let me start with this. So you heard from Lieutenant Ungasser, but United Way has been in this community for 95 years, and we've been at the front lines of community problems, both everyday problems and crises, which we know too well throughout the region across our 7 parish service area. But today, more than ever, we're needed. And as Lieutenant Ungasser pointed out, more than 1 in 2 households are struggling day to day, often unable to afford to meet their basic needs, let alone address an emergency that's been placed upon them. And we call those ALICE households, and those folks are living above poverty and often in poverty struggling. So the ALICE data is even more important now than ever, as we've seen our vulnerable communities have been impacted by the pandemic and the economic crisis that's been upon us. But we're also working with our nonprofit partners across the region to address these challenges, and we're thankful for them. And so while we saw some significant challenges that began in March of 2020, we'll all remember those days as it became evident that we were going to be on a journey unlike we'd seen before due to the global health crisis and the economic crisis that we were experiencing. But ALICE still remains central. And in fact, our blueprint for prosperity, I believe, positioned us well to support ALICE households, not just through the pandemic, but also to prepare for the future. And United Way of Southeast Louisiana is here just to do that. So I look forward to hearing about new and innovative strategies for stabilizing ALICE households throughout our region from our parish leaders and experts today. Many of you I know and call you friends, so I appreciate your leadership and support. And as I said before, at United Way, we believe in teams, and we take a team approach to everything we do. And so it's my pleasure, it's my honor to introduce our Executive Vice President, Chief Operating Officer, and also my friend, and I call her a colleague, Ms. Charmaine Cassiope. Charmaine. Charmaine, you're on mute.
I am, right? Thank you, Michael, and thank you to everybody who's joining with us today for this important conversation. I'm privileged to serve not only as the Chief Operating Officer, but also as the lead staff person for policy and advocacy. And I think it's fair to say that in order to create systems level change throughout our community and to realize the full potential of a vibrant Southeast Louisiana, I think it's fair to say that we must focus on breaking down barriers that hold us back from achieving all the opportunities that are possible, not only for our families living in poverty and those who qualify as ALICE, but we must work collectively and collaboratively across our 7 parish region and across this great state to ensure that we are enacting smart policy and programs that will help us in the areas of health, education, and financial stability. It is my privilege to have the opportunity to welcome our panelists for today's program in the capacity that I have for serving in policy and advocacy. I work with these individuals very closely, and I would like everybody to join with me today as we welcome our panelists. Valerie Rowland, Deputy Chief Operating Officer for Jefferson Parish, Joshua Cox, Senior Advisor and Director of Strategic Initiatives with the Office of Mayor Latoya Cantrell, Parish President for St. Bernard, Guy McGinnis, and St. Tammany Parish President, Michael Cooper. We are indeed honored to have each and every one of you participating with us today. Your leadership is critical to the health and the economic stability of our region and to all of the citizens who choose to live, work, and raise their children in this 7 parish area. So thank you. I'm also honored to have the privilege of being able to introduce to you 3 extraordinary subject matter experts from our community who will be posing questions to our panelists from each of our parishes on health, education, and economic stability, as well as ALICE. Please join me in welcoming Connie Ballone, President and CEO of Health and Education Alliance of Louisiana, a United Way Southeast Louisiana community partner. Thank you, Connie. Dion Graham, Executive Director of the East St. Tammany Rainbow Child Care Center, also a leading Southeast Louisiana community partner. And Catherine Lemoyne, Director of Development at the Nunez Community College in St. Bernard Parish. Thank you all for being with us. And it is now my privilege to turn this program on to Kirby Nagel so we can get started.
Thank you so much, Charmaine, and thank you again to our speakers who are joining us and our parish leaders who are joining us today. At this time, we're going to begin our our question portion of the program, where we'll allow our subject matter experts to pose questions in a forum style to our parish leaders. Parish leaders, remember, you have 4 minutes to respond to each question. We'll ask one question each in the areas of health, education, and financial stability, and equity, additionally, for United Way of Southeast Louisiana, which is a longstanding component of the work that we do to eradicate poverty and stabilize ALICE households in our community. And at this time, what I'd like to do is welcome our first question and subject matter expert, Connie Ballone, once again, President and CEO of the Health and Education Alliance of Louisiana, to pose a question to parish representatives on health. Connie, you have 3 minutes to ask your question. And parish representatives, there's no particular order in which you're required to respond. So please take your time to respond appropriately as soon as Connie finishes. Connie, take us away. Thank you so much.
Good morning, everyone. Thank you very much, Charmaine and Michael, for this opportunity to participate. It's truly an honor to represent the students and the residents of Louisiana in this forum. What I would like to talk about is how COVID-19 has shown a bright light on the standing health disparities in our community. We've had many other reports recently, such as the Harvard report and the Place Matters report, that shows the importance of an income level that is high enough to sustain basic needs for families in the community. And we know that just in Orleans Parish alone, life expectancy is gone down by 25 years with 3 miles apart because of the ability of families to access basic health needs and other economic necessities. My question is, illness can put a family into their emergency funds and force that family below the ALICE poverty line. And that can be tragic for many, many families in Louisiana. In your view, how can parish government help ensure access to health care for everyone in Louisiana and ensure that income levels do not determine your life expectancy? And I'll go on mute.
I'll be happy to respond. This is Mike Cooper, Parish President of St. Tammany. And first, thanks for including me in this conversation. I'm happy to be a part of this. For receiving Biz New Orleans 2020 Executive of the Year, a well-recognized, well-deserved recognition for all the hard work that you do for our community, Michael. Thank you. To answer your question with regards to parish governments and how we can help ensure that the income level doesn't affect life expectancy. In 2021, St. Tammany Parish will open its 3rd federally qualified health clinic, FQHC, which many of you are familiar with. It will be opened on the Safe Haven campus here in St. Tammany. The geographical location of the clinic bridges the gap between the current clinics in Covington and Slidell. While the Safe Haven campus is focused on behavioral health, we thought it was very important to integrate primary health care from the beginning to address the disparity in life expectancy. Beyond access to primary care, we've learned the connection between income level and life expectancy is a complicated one. Studies have shown access to health insurance is not the only factor when it comes to life expectancy. The biggest indicators of life expectancy are health habits. If the individual smokes, their diet, their exercise routine, and other factors. St. Tammany Parish Health System here on the North Shore, formerly St. Tammany Parish Hospital, based in Covington, has begun an initiative called Healthier North Shore. This is a collaboration between government agencies, healthcare institutions, nonprofits, and representatives of the business community to come together to build a healthier parish through education, awareness, and providing resources. By working together, we hope our community will become more health aware and find ways to collaborate to address the health concerns in our community. On this Healthier North Shore Committee includes our Director of Safe Haven, Mary Burkell, and myself, and we look forward to working in collaboration to address these concerns.
I'll go ahead and jump in. Can you guys hear me? All right. Charmaine and Michael, it's such a pleasure to be here. To everyone who's joined the panel, it's an honor to get to address you. To answer Connie's question, I am really going to take the view of what we did during the pandemic. The beginning of Connie's question really laid out how COVID-19 has disproportionately impacted Alice families and families of color. And so as we were thinking through our city response, we knew that we'd have to be intentional about trying to move resources and activities towards groups that, like Connie pointed out, just have less access overall. And so, there are a couple of things that we're really proud of that happened throughout the course of the pandemic. The first is that we were able to stand up mobile testing sites, which happened with the help of the Louisiana National Guard, but the model that we were able to get off the ground here ended up being replicated all across the country. And that no doubt allowed us to suppress the virus in the beginning stages when we were surging in March and April. The second thing that we did, and I really give Dr. Jennifer Avegno credit for this, we set up sort of community testing sites within communities that would be less likely for folks to come to, so folks who might have transportation constraints, we were trying to bring testing more into those communities. And so we ended up setting up a mobile testing unit. We had a relationship with CORE that was a testing, Sean Penn's testing nonprofit that does phenomenal work. And so we were able to sort of burrow ourselves deep into, these very Alice communities that we care so much about, trying to A, do testing, B, do community education, and C, hopefully allowing that to lead us to contact tracing. Because, at the end of the day, trust is required in order to get people to tell you the information needed so that you can try to figure out, what services or help to offer. So that was part of the initial approach. And then we realized that, testing alone isn't going to work for families who have all of these additional problems. I mean, in the first couple of months of the pandemic, in New Orleans alone, we saw at least 40,000 unemployment claims. And so we realized that we've got two competing problems. One problem is that a good chunk of our workforce that was dependent on the hospitality industry didn't have jobs to show up to. And the other problem is we've got a raging pandemic that needs more community health workers to help suppress it. And so, we worked with a nonprofit partner called Resilience Force to retrain dislocated hospitality workers, who are a lot of our Alice families, to do community health work. And they would do community health work 3 times a week. And the other 2 days of the week, they were at Delgado getting additional certifications so that at the end of a 3 or 4 month period, they could be spun off into high wage, high growth jobs. And so I'm really excited to say that at this point, we've got about 70 community health workers, and they're going to be critical in helping New Orleans roll out our vaccine campaign as we continue to develop it. So, you know, the point that I think I want to drive home is that, you know, inequities don't get solved without intentional focus on how you're going to move resources accordingly. And so that's something that we've certainly been cognizant of and will continue to be.
Thanks so much, Josh. At this time, I'd like to introduce Pam Williams. Pam, I just saw you come off mute. She's the Director of Housing for St. Bernard Parish, joining us today. And so thank you so much, Pam, for joining us. If you'd like to provide your response at this time.
Thank you for allowing me to be here. I'm sitting in for Guy McGinnis. Unfortunately, the president had a dual schedule for this time. And so he called me and asked me if I would get on. So I'm going to give as much as I can from what I know from the parish. So if anybody want to ask any questions or anything, I mean, you know, we too have been testing and offering testing. My comment, I want someone to ask me a comment about fostering a better relationship. Always, to me, information being given to the public is going to help them to better decide what they need to do for themselves. Now, we had been sending out information to the public as to where testing was, and we put it all over the parish. So if you weren't in this area and your transportation was your issue, then we brought it to another part of the parish. So everyone had an opportunity to get tested if that's what they needed to do. I think our positivity rates are a little bit over 5% now, but before that we were pretty low. But we are still offering testing to anybody that needs testing. And we too have unemployment issues with a lot of, I work for the housing, I run the housing department. So a lot of my constituents that I serve are on public housing, Section 8. And so a lot of them have lost jobs, they're on unemployment, then unemployment ran out. And so now we're seeing where we're paying more of their rent, but they still have other issues as far as utilities and food and childcare and all other issues that you're going to discuss today. So we're looking into a lot of things that we could do to help our residents as well.
Thanks so much, Pam, for joining us and for jumping in as well. We understand how schedules work right now, so we're certainly grateful that you could join us. At this time, we will transition into our education portion of the section. And I'd like to welcome Dion Graham of East St. Tammany Rainbow Child Care Center. Dion, thank you so much.
Thank you so much. I'd also like to thank Charmaine and Michael for pulling our community leaders together to have critical conversations to address the needs of the people in the community that we serve. I'm sure you've heard many, many times over the past year that childcare is the backbone of the economy. And about 67% of children birth through age 5 have both parents or their single parent in the workforce. Childcare is typically the most expensive item in a family's budget. Typically, the families we serve at Rainbow Child Care Center, it equates to about 1/3 of their salary. And even more than housing and the cost of annual tuition at a public college, 1 year, it's even more than that. A survey conducted by the Louisiana Policy Institute for Children last year of families on the Child Care Assistance Program, the waiting list found that 2 in 3 respondents were borrowing money to pay for childcare. Borrowing money to pay for childcare. Can you believe that? And nearly half were sacrificing on basic household necessities to cover the cost of childcare. My question to you is, what can be done to make safe, reliable childcare preschool more affordable so that Alice families living paycheck to paycheck can continue to work and children don't start school behind their peers?
And if we'd like to, Parish President Cooper, we can start with you again.
Thank you. And Dion, I can't see you on the screen, but I have to say, I know Dion and I know her passion for what she does at Rainbow Child Care Center in Slidell. And I'm hoping that we can restore our Bubbly on the Bayou fundraising
Yes.
event, because I know that's so very important to sustaining what you do. You bring up so many great points. St. Tammany Parish Early Childhood Network, which is a collaboration of St. Tammany Parish School System, Head Start, and Type 3 Child Care Centers are all available options here in St. Tammany. The mission of the network is to provide high quality, developmentally appropriate early childhood care and education for children from birth to age 5. And I know that I'm not telling you anything that you don't know. But this is done so that each enters kindergarten ready for success. To fund these types of programs, we need to ensure the federal funding continues to come to our area and even expands. The funding I'm referring to is the Child Care Assistance Program, Non-Public Schools Early Childhood Development Grant, and Head Start. These funding opportunities are the foundation for these programs. We need to communicate with our legislators that this remains a priority for our community.
Thanks for your question, Dion. You know, I think the answer. Can y'all hear me? Good. All right. You know, I think the answer is pretty simple, and President Cooper hit on it. This takes money to do, and there's no secret that budgets are moral documents. And so, you know, I think what it takes is a commitment from the federal level, no doubt. But I think also it takes a commitment from the state level. But, you know, we as local municipalities can also stand to put our money where our mouth is. And so, you know, in New Orleans in 2017, we were the first city, I believe, in the country to put $750 grand of funding directly towards early childhood education in our city budget. And I believe that money has been allocated every single year, ending with, in this year, we have increased it to 1.5 million that's going into early childhood education. That's going to be in this 2021 budget. Now, you know, obviously that doesn't even begin to meet the scale of the need. But what I'm proud of is the fact that, you know, now, 10 years from now, there's no way that a mayor who's here after us can put any less than 1.5 million in the budget. And I'm hopeful that as we continue to have more funding opportunities, you know, you got to give the legislature credit. They created an early education childhood fund that will match the funds that cities are putting up. That creates tremendous opportunities for us to continue to increase the funding that we know that our kids need. At the end of the day, Dion, I don't know that there's a better investment that a government can make, period, that's going to give more of a return than to invest in early childhood education, period. And so, you know, we are going to continue to try to do that here in Orleans Parish, but I think it all boils down to, you know, ponying up and finding the money for it, because it's really that important.
Thank you, Joshua and Mike.
Valerie Berlin, I know you're able to get online and join us. We'd like, if you're able to provide a response. Thank you again for spending some time with us this afternoon. It looks like you're off mute now, Valerie. Are you able to speak? Oh, looks like we're having a little bit connectivity problems there, Valerie. We'll send you the call-in number via chat. Pam Williams, anything you'd like to add on early care and education in response to Dion's question?
No, as both speakers have put it on the line of money. is what we need to be able to, and early childhood education is definitely so important. Um, I think this is just my personal thoughts. I know the TCA program in New Orleans has always been a great program. When I used to live in New Orleans, so I know my kids, two of my kids have actually been a part of that program, and it is such an excellent program. We don't really have a TCA kind of program here, but I have been talking to the parish president about bringing that here. I'm kind of like, even though I'm the housing director, I'm also the social service person as well for the parish. So we've been talking about that because right now, like with school being closed and coming back and then being closed again, we need somewhere. A lot of parents have had to go to work. That daycare and that early childhood education is going to be so important to those individuals that do find jobs and can go back into the workforce. So hopefully we can get some funds to be able to make that work.
Thank you so much, Pam. No question. And thank you to all of our parish leaders who provided a response there. We can all agree at Southeast Louisiana. I can see everybody nodding their head. Yeah, we know it's a matter of funding. And so we're grateful for all those that brought that to attention today. Valerie, I'll give you one last opportunity, maybe see if your audio is any better now before we switch topics. Looks like we're still having a tough time hearing you. We'll make sure we give you some opportunity to respond at the end if you're able to connect. As I mentioned, I'll send you the call-in information through the chat line. At this time, we'll switch gears yet again to financial stability, the third component of our question forum. And once again, we'll bring on Catherine Lemoyne, from Nunez Community College to pose a question to the leaders. Thank you so much, Catherine.
Thank you so much. And thank you to Charmaine and Michael for organizing this Nunez Community College. We're located in St. Bernard Parish. We offer transfer pathways to the four-year college and a wide variety of workforce development opportunities. So I'm really excited to talk with all of the panelists today about financial stability. So just a little background, according to data from 2018, nearly half of jobs in Louisiana were classified as low wage or not able to support a family household survival budget with two earners. Additionally, a large and growing number of workers are paid hourly. Hourly workers are more likely to have fluctuations in income due to frequent schedule changes and variable hours, and they're less likely to receive benefits such as health insurance, paid time off, family leave, or retirement benefits. So the question is, what public-private partnerships can we build to increase opportunities for low-income households to receive training for high-demand living wage jobs?
I'll go first again. Particularly now with COVID, we have seen the effect on the seasonal workers, the part-time workers, or even the full-time workers that are not earning a living wage. And they're becoming particularly affected now because of the COVID situation. I work closely with St. Tammany Corp., which is St. Tammany's Economic Development Foundation, and our work includes monitoring our workforce to make sure that we have what companies are, what they're looking for, so that we can help with placement. With St. Tammany Corp., we're in constant communication with North Shore Technical Community College, which is one campus is located here in St. Tammany. So the needs of the business community are being offered by this important educational institution here. In addition, we encourage all St. Tammany Parish public high school students and all students to explore their high school trajectory options, whether they choose to learn a technical skill or whether they will choose the academic route. Students should also focus heavily on earning TOPS where available and through maintaining their required GPA if possible. This scholarship offers a technical school option as well, or a university option. This added financial support can aid in the proper training of our developing workforce. And we're also fortunate to have, as two other parishes are, the presence of Tri-Parish Works here in our community. This arm of Louisiana Workforce Commission also offers training opportunities, apprenticeship programs, and scholarship opportunities for the training. We need to work as diligently as we can to promote public-private partnerships so that we can increase opportunities for those that are low-income households so that they can receive training. And that is our goal and our mission.
Thank you.
So, you know, in New Orleans, we have been really focused on this problem, and I think I sort of answered this one in mentioning what we did with Resilience Force, but I'll briefly go through it again because I think it's a model for what we're hoping to replicate. You know, we had a scenario where we had lots of hospitality workers who were dislocated because of the pandemic, and we also had a desperate need for community health workers to help suppress the virus. And so we braided together funding. Some of the funding came from WIOA dollars, so Workforce Innovation and Opportunity Act dollars. Some of it came from various different philanthropic sources. And so we braided it all together and were able to create a program that allowed folks to get training while they're also getting paid to help us meet a need that we as a city had in the immediate term. And so they were working 3 days a week as community health workers. And then on the other 2 days of the week, they are getting training at Delgado Community College with the hope that they will be spun off into a more lucrative, higher wage job within 3 to 4 months. And so, you know, we're looking to do this in multiple fields. I mean, in South Louisiana, we know that we're going to keep seeing disasters every single year. You know, right now it's a pandemic, but next summer it might be a hurricane or it might be a flood or something that we can't even imagine. And so, you know, we want to keep this as an open option because we're always going to need to have folks who know community, who are from here, be ready and able to respond to these crises, and especially to respond when these crises change the economic realities of where jobs are available and what jobs are available. And so, you know, our Office of Workforce Development has secured another $3.6 million from the state and from the federal government, and we're putting that money directly on the ground into more dislocated worker programs so that we can have folks doing two things at once. On one end, they're either doing a training or they're actually working for a particular, you know, company. In this case, they were working in conjunction with, you know, the health department and, you know, the Louisiana Health Department. But at the same time, they're also getting trained so that at the end of a 3 or 4 month cycle, those folks can move on to a high wage, high demand job, and we can make that seat available for someone else.
Thank you.
Pam, anything you'd like to add before we switch topics?
Hi, Catherine. Just wanted to say hi, and look, you know, I already know Nunez. We're kind of on top of what we need to do for our residents, for even the high school students having the dual enrollment program, which I think is really a great and excellent program where they can learn technical skills for those that don't want to go on a 4-year college, and then they could transfer those credits if they do want to go into a 4-year college and earn a degree. I mean, you know, so we're preparing our residents for the workforce, that's for sure. And Nunez has done a great job. Thank you, Catherine.
Thank you.
No question about that, Pam. Thank you so much. Lastly, we'll switch to the last portion of our question and answer forum, a topic on equity from, once again, our president and CEO, Michael Williamson. Michael.
Thanks, Kirby, and let me also just kind of say thanks to everybody for your candid answers to the questions and all the work that you're doing, and so kind of set the stage for this question. And we all know that, and I said it before, 2020 was a year just wrought with immense challenges. In the middle of a pandemic, we were in the cone of uncertainty, what about 7 or 8 times? So we were, you know, always having to deal with the fact that another disaster may hit us, and certainly our colleagues, our friends, our neighbors to the east and west of us saw those experiences instead of us. But and many people have been longing to go back to normal. You know, folks saying we want to get back to normal. But here's my point of view on this. we can't afford to go back to normal, at least the normal as we knew it, because the normal as we knew it had people in our community, 1 and 2 households that were struggling to make ends meet, often choosing between buying gas and groceries versus other basic needs, which is not acceptable, and it's not an acceptable normal. We also had a normal where we know, and this is not an indictment, but we know that systemic racism, gender inequities, and social injustice existed in our communities. And so as we look forward to 2021, I think the question is for all of us, and I'd be interested to hear your answer, how can we work together to create truly equitable communities? Equitable would be in all caps, where all of our citizens are healthy, educated, and financially stable.
Well, thank you, Michael. Very, very good question and very good perspective. And I'll say it at this moment that we do need to work together to create what's equitable. And 2020 is certainly a year to put in the rearview mirror. And returning to normal can't be the normal that we had, particularly with respect that you mentioned. And I might also say this too, as I hear the perspectives from the other parish representatives. You know, each parish is different. We're a large parish, but we're quite different than Orleans Parish, quite different than Jefferson. But we have a lot of the same concerns, but maybe we address it in different ways. The mission here at parish government is the life, health, and safety of each and every one of our citizens. We remain steadfast in carrying out this mission by exploring different ways to address the needs of the community. We will continue to work towards a robust transit system, increase affordable housing, whether it be through Habitat for Humanity, Volunteers of America, or your private builders. We're certainly looking particularly to increase affordable housing in our community. Supporting our successful public school system, and supporting our daycares, our pre-K systems as well, and making healthcare services more accessible and affordable. That's from the top of the line healthcare that we have here in St. Tammany, our 4 major hospitals, as well as our clinics and healthcare professionals. We need to make this available and accessible to all of our citizens and affordable. These issues need to be looked at collectively, and no one entity, I feel, can address these needs alone. We need to collaborate and create new perspectives with frequent and open communication, and learning and implementing best practices for similar communities of our size and makeup. I feel that prioritizing needs and establishing the goals to meet them and devising plans to achieve these goals is how we're going to be able to truly create equitable communities, particularly here in our area.
Thanks, Michael. I mean, to directly answer your question, I think you do it intentionally, right? It can't just be a one-off program. It's got to be a part of how you think about every single thing that you do. And so, you know, part of what we've been struggling with is, you know, how, especially during the pandemic, how are we infusing equity in everything we do? So one of the things that I'm really proud about is that we were the first city to secure FEMA dollars to do a mass feeding program. $18 million a month was coming from the federal government, put on the ground into the bellies of a lot of our Alice families and their children. That's an important part of equity. Another part of equity is housing. I mean, Mr. President, President Cooper just mentioned it. It's clearly a problem everywhere. Not only were folks struggling to find affordable housing before the pandemic, but, you know, without opportunities to work, you know, we're facing an eviction crisis. There is an eviction crisis. And so, you know, we diverted funds, CDBG block grant dollars. We diverted $10.4 million towards rental assistance to keep people in their homes. I mean, if you're talking about the well-being of a family, I don't know that there's too many social determinants of health that are much bigger than housing, right? Once housing goes, you have this other cascade of resulting problems that comes from that. So we've made big investments there. You know, oftentimes after disasters, when federal and state aid comes in, folks who are lawyers or who know lawyers or who are good at navigating complex bureaucracies, they're able to actually get the benefit. Whereas, you know, a lot of our Alice families and a lot of folks who, you know, go to work hard every day, they struggle to figure out the right benefits that are for them, right? Sometimes they might even take benefits that years down the line, they realize they were better off not having. And so, you know, we started a program called the Neighborhood Navigator Program. And the goal of it is to get citizens in their own community to be able to help their neighbors navigate the labyrinth of unemployment or, you know, stimulus dollars that they might be entitled to, other tax benefits, et cetera. I'm proud to say that, you know, we are partnering with United Way on the VITA sites piece. So United Way has been an incredible partner in helping us, you know, get many of our residents get their taxes done, right? It's tough to get a stimulus check if you haven't done taxes for 3 or 4 years. So, you know, these are the very small ways that that we're trying to think about infusing equity. And, you know, what we hope is that the totality of all of these things adds up over time to a more equitable 2021. And so that's what we'll continue to be pushing forward on. But Michael and, you know, Charmaine, I know y'all know we, and I don't just mean Orleans Parish, I mean America, we've got a long way to go, and it'll take all of us infusing equity in everything we do in order to truly start to make a dent.
Thanks so much, Josh. Pam, any closing thoughts you'd like to add?
A little bit. When we first came back from COVID, what we did was we did a needs assessment for our community to kind of see where our residents were, like who was not working, getting unemployment, if you had an issue with housing, utilities. I mean, so when we got funds from the federal government for CSBG and LIHEAP, which is the Low Income Energy Assistance Program, we target those residents to what they told us their needs were. So this department here in the housing, no, we don't just do Section 8 in housing. We do rental assistance. We do utility assistance such as water, gas, lights. We do the food stamp application for individuals that can't navigate the system themselves. We also offer, we did the census. I was on part of the census team. We do taxes for people that can't do taxes for themselves. Actually, I can do taxes. And I did some of the stimulus get my refund from the stimulus stuff for people that didn't know how to set up information to be able to get the check to come to them. So we were doing a lot when we came back from COVID. And I mean, we continue to still do a lot. And the need is still there, of course. Even though energy says they're not going to turn lights off. So we have people with bills like $600, $700, $800 because they can't pay the bill. And so we are steady trying to approve them for programs to help them get equity in their lives and get some kind of stability. So when they do get back in the field, that they can, you know, not worry about my light's not going to be on, or I'm going to be evicted from my home or something like that. So yeah, so we've been doing a lot in this community for our residents.
Thank you so much, Pam. And to all of our parish leaders who are able to join us today, and those who unfortunately were not able to join us, we're grateful for the time and the attention that you put into this conversation today and to share your perspective with our attendees. As a reminder to the attendees, the messages that you dropped in the chat box, we will share those with our elected officials and staffers they're representing today. So thank you for sharing your comments with us in the last few minutes. As Charmaine Cassiope provides our closing comments, please feel free, once again, to share any more thoughts, closing words that you have with the folks that have joined us on the webinar today. And with that, Charmaine, I will turn the webinar back over to you for our final closing words. Thank you so much, everyone.
Thank you very much, Kirby. And I can just tell you that I hope this conversation for everyone participating today has illuminated the critical role that we can all play working together. I hope each and every one of you here understand that United Way stands strong, committed, and faithful to the challenges that all of our region faces. In fact, that all of the state faces and that this nation faces. As a leading not-for-profit, we want you to see us as your partner across the sectors that impact our Alice population, and that can help us find real solutions to ending poverty and building resilient communities that are equitable. I can tell you, for me today, I feel honored and privileged to serve the United Way for Southeast Louisiana, where such strong, capable leadership is at the local municipal level, serving the needs of our citizens. I'd like to tell you that collaboration for United Way of Southeast Louisiana is at the core of what we do each and every day. Collaboration will allow us to evaluate best practices, examine data, and move together to build the resilient communities we know can help to build economic prosperity for all the families and the citizens we so deeply care about. My hope is that today's conversation, you will think about, as parish leaders, the opportunity to join with United Way in creating an official entity called the Council of Governments. I know the kind of resiliency that could come from us having the opportunity to convene at least 4 times a year as a Council of Governments to discuss these issues. So I'll be reaching out to you to see if you'd be willing to participate in that call to action for us to really strengthen our partnership together. May God bless you all. May you please stay safe. And just know that your United Way is here to serve you and the constituents that you are serving in your respective communities. Thank you so much for participating.
Thank you, Charmaine, and thank you to all that joined us today. That concludes this edition of the Louisiana Leaders webinar series from United Way of Southeast Louisiana. As a reminder to our attendees, we will send a follow-up email with a link to this recording so that you can listen back in if there's any particular segments you'd like to catch once more or share on social media with your friends and acquaintances. Additionally, we'll have information on how you can get connected with United Way and join our efforts, to advocate on behalf of Alice households and those living in poverty in Southeast Louisiana. To Charmaine, Michael, our speakers, and our parish leaders today, thank you once again, and thank you to all our attendees who joined us. Please have a good day.
Thanks,
everybody.